Hello, everybody who is joining us today. Thank you so much for giving us your time. We are going to give it just a minute or two to allow a few more people to join us before we get started today. Mhm. And a big thanks to all the folks that are hopping on. We are going to take just one more minute, let a few people join, and then we are getting started. We are so excited to have Anita from Neighborly with us today. And when we get started, we're going to have a conversation about scaling outreach for community care. All right, amazing. Jen, please take it away whenever you are ready.
Everyone has joined us today. My name is Jennifer Flores. I am the Blooming Health Senior Manager for Strategic Growth, and I will be your interviewer for our webinar today, Automation for Improved Community Health Outcomes, a Neighborly Case Study. Before I get started, I wanted to touch on a few housekeeping items. Participants are muted, but we encourage you all to put any questions that you have in the chat for our Q&A at the end of this call. This webinar will highlight the easy-to-use Blooming Health Automation workflow feature and the impact that it has on organizations, including improving community health outcomes, reaching diverse communities effectively, reducing preventable readmissions and hospital visits, combating staff burnout, and scaling organizations' outreach without adding headcount. We will end the webinar with a short demo of how workflows automations can be easily set up on our Blooming Health platform. Today we are highlighting Neighborly Care Network, a trusted champion for older adults in Pinellas County, Florida, for more than 60 years. As a nonprofit leader in aging services, Neighborly delivers essential life-sustaining programs including Meals on Wheels, adult day programs, senior dining, transportation, and comprehensive support services that help older adults live independently, safely, and with dignity. We are joined today by Neighborly Care Network's Director of Nutrition, Anita. I have had the pleasure of working with Anita for about a year now. Anita's passion not only for the programs that she manages, but ensuring that all of her clients have the resources they need is inspirational at best, at least. Anita, can you please introduce yourself and tell us a little more about your role at Neighborly Care Network?
Sure. I'm Anita Seiler. I am the nutrition director and I'm also the licensed dietitian for Neighborly. I oversee the nutrition services, which includes Meals on Wheels, congregate dining, nutrition education, and one-on-one nutrition counseling. But Neighborly also provides other senior services to keep people independent and out of institutional care, like adult day centers and transportation. We serve about 4,000 seniors in a year.
Awesome, thank you. I know that on the platform itself and our work together, we have helped to automate some of those processes, but I just want to take a step back on what does a day-to-day look like for Anita at Neighborly Care Network? I know you wear many, many hats. What does it look like for you and your team?
Yeah. Or I could be doing anything but from overseeing data, reports, a lot of Excel, of course. I could be at the sites, participating yesterday I was just at one of our sites in Gulfport where someone's turned 104. So it's a big mix of things, and I'm really happy to be in the community.
Amazing, 104. Wow, that's
Yeah.
a celebration, definitely. What are some of the biggest challenges that your team has faced
I
recently?
think we have a lot of the same challenges as all nonprofits do, right? We're trying to do as much as possible with the limited resources that we have. You know, funding can be uncertain at times. Um, and so I'm always trying to find ways to do things smarter, faster, more automated so that we don't have to do very many manual processes that require a lot of staff time.
Yeah, that actually covered my next question. For workflow automations for us, I can tell you the technical terms of it, how it's supposed to help you all, but it's great to hear that automations help with staff timing and give timing back to you all who are doing many, many different things. But I did want to take a moment to address maybe an elephant in the room about automations and technology, specifically in social care. I think that many times social care workers look at automation as maybe something a little bit negatively, taking away that human element. How have you overcome this and how have you seen it work for you all?
hmm Yeah, I know it can feel impersonal at times, I think. And for some seniors, it can be daunting that we're communicating with them in different ways instead of that more one-to-one, maybe a phone call. But we're always behind the lines. If someone has a question about something that we've recently sent out by text or email, they can always call us and we're happy to explain in detail or in person what's going on and what are the updates. So I think that we're still available to have that one-on-one interaction as people need it. But I think a lot of seniors are open to being communicated to in different ways, and so I haven't seen much pushback from how we've changed our communications.
And can you talk a little bit about the ways that you have utilized the workflow automations on Blooming Health and maybe otherwise to help improve your processes?
Yeah, so recently we had to contact at least 300 seniors who were in danger of either losing their SNAP benefits or there were delays in payments for their SNAP benefits. So we used automation with surveys and uh, ways to use data from those survey responses to notify our team that someone indicated that they needed extra resources for food. So uh, it only took, I would say, less than maybe minutes, maybe half an hour to set up. But I was shocked that within a couple hours we were getting responses from the 300 people that we had reached out to. It was so fast. I didn't even have enough time to tell our team that we were going to get these automated responses in our Meals on Wheels inbox. So it was really interesting to see how fast that worked.
Awesome. Before automation, like let's say that you had to send these out, you had to call people, how much staff time were you able to save utilizing these automation processes?
Oh, it would have taken days because we would have to spend time on the phone with everyone. And then you leave voicemails and you wait for callbacks um, and then processing the data could take a few hours. So it was really quick and really easy to set up. There were a lot of like tutorials or step-by-step instructions on how to set up the workflows and the surveys. So overall, I was really surprised of how easy it was.
With multiple different organizations on the call today, what would you say was one small workflow that you used that everyone could start as soon as possible?
I really like how you can tie survey responses to automated responses. So, like with the SNAP survey that we sent out, if someone said, "Yes, I need extra food," that would automatically send a message to our Meals on Wheels team to get the delivery set up for them. And so I didn't have to collect all the responses, put them in a spreadsheet, make a list for the team. Like it was pretty much it basically inserted into our normal workflow of how we can get referrals out and get people started on meals. So I would say that utilizing the survey function with the workflow to automate the next response or the next step in whatever action you would typically take would be the first place to start.
Awesome. I know we've talked a lot about how these workflow automations help your staff and you, and could potentially help other staffs as well. How do we see this helping your clients on the back end or on the end of receiving services?
Well, they definitely get services faster, right? And that is always a blessing when they're waiting on food, they need food. Especially, we haven't had to use it yet, but I have it built. Responses after a hurricane. So we always check in before, are you prepared for the hurricane? Do you have everything you need? And then again, afterwards, do you have any unmet needs? And so being able to communicate with thousands of people in a matter of minutes just speeds up our ability to help them and get resources.
Incredible. Yes, especially in Florida. That's a really nice tool to have. Um, how do you see, outside of emergency responses, how do you see automation supporting Neighborly's mission over the next 5 to 10 years?
Well, we're always looking to do things smarter with the few resources that we have. And I think that uh, if we can operate as leanly as possible, that just leaves more of the limited funding that we have to go back into services. And so that's my goal is to reinvest any money that we would have spent on staff time or another or other hiring more people. I can put that back into providing more meals, for example.
Incredible. I know that you mainly handle nutrition services, but I know in some cases we've sent surveys out to see if there's other additional services that people need and how to contact certain departments. But curious about how you see this working outside of nutrition services and how it helps you connect as a team.
Um, I think that outside nutrition, our transportation services also uses it to communicate with their clients if they have updates or other announcements they have. So it definitely helps our organization across the board. And I think overall, it's helped with morale on the team. No one has to do manual data entry. No one has to spend hours on the phone. I think whenever I would say it's survey time, I'm sure I got some groans, probably not to my face, maybe some eye rolls, but I know it can be a process and it takes time that they would otherwise be spending with clients. And so I think that's another benefit is where the front level staff are able to spend more time with clients rather than doing administrative work.
Um, um, and let me see one more question here. What advice would you give to organizations worried about doing more with less?
I think that I recommend trying to use technology as much as possible. I'm really thankful for all of the support I got with implementing Blooming Health. They answer all my questions with how to do things and walking me through step by step. And so I think that more and more we're going to have to rely on technology to do more of the repetitive, mundane tasks.
Awesome. Marina, I'm going to have you pull up our PowerPoint. If there is any Q&A in the chat for now, I can answer, or we can answer anything, but wanted to highlight exactly what we are talking about with automated workflows on the Blooming Health platform. So workflow automations take our survey functionality and adds an automated component, assisting in follow-ups, automating referrals to outside departments or organizations, or automatically sending surveys to gather additional information. And that is what Neighborly Care Network and Anita's team has used our platform for and has already set up amazing workflows for hurricane emergency notifications, alerts, data going back to them so that no one is left out and saves their team time. Um, Marina, was there any questions in the Q&A? Not, I'll do a quick demo.
I had one here asking if end users trust these communications.
Yeah, we got a lot of questions at first. Is this reputable? Is this a scam? Especially amongst seniors. And so our team was well aware that we were changing to this platform, and so they were able to respond right away and say, yes, you can trust these messages.
That's great. And is there any like signaling or branding to let people know who is sending them the messages?
Yes. So whenever we add a user to the platform, we send them a welcome message to say, hey, we're Neighborly, and this is our new communication platform. And so, and then of course, staff are always able to answer questions about it.
Yep, and then also to add on Anita's comment, our system does pull in a caller ID that shows Neighborly Care Network or an organization that the messages are being sent to. It also, when anyone answers the phone, they are met with a voice recording. So I believe it's Anita on ours that says, "Hi, this is Anita from Neighborly Care Network. Please listen to the following message to help overcome those questions and those and build trust within your communities."
That's great. Jen, why don't we hop into the demo and give these folks a chance to submit a few more questions?
Awesome. Going to steal the screen from you. Perfect. So I'm going to take a couple of minutes to show you all the Blooming Health platform and how easy it is to set up a workflow on the platform. So um, create a workflow, you have to create a survey because it is the automation part of a survey, of the survey functionality. The survey, you can ask up to 30 questions. You can ask multiple different resource questions. One of our biggest use cases for workflow functionality has been food insecurity, our community-based needs, assessments, surveys like that. For this example, I'm going to use a webinar demo survey. We're going to add a description, and then I promise I won't add 30 questions on here and take up all the rest of your time for the day. I'll show you with just one. Like I mentioned before, when we send out these surveys, any type of messaging on the platform, the clients will hear a recording of whoever is at the organization that's part of the program. For this example, we're going to use a food insecurity question, and we're going to say, 30 days, have you felt that you did not have yes or no? Be our survey example, and that's how easy it is to submit a survey. You can also add conditional branching in the survey if you need to ask additional questions, or if one answer choice is just not sufficient enough, you need to branch them out to another question. Now taking it to the workflow feature. Workflow features, again, are going to be very simple to set up. There are different follow-ups that you can utilize with the workflow. So our base is going to be a survey. We can do a couple of things based on that question. We can send a broadcast message. We can initiate or update referrals. So if you're working with a different department, like Anita mentioned, if she needs to send a home delivered meals client a social determinants of health survey, they identified as needing transportation, or say they needed transportation after a hurricane, she can automatically send that referral to her transportation department. Or if we're working with a different organization or an outside organization, we can send them the referral as well. Or we can send a follow-up survey if we need additional information from that client. So we're going to click on the survey here. Here is our survey that we just completed. For this specific survey, we're going to do one question, multi-action. We're going to click on the question. For those that answered that they felt that they did not have enough food, we're going to actually refer them out to a different organization. So we'll save that. We'll click on this again. And then for those that pressed, or for those that identified as not needing additional food or that they were not food insecure, we're going to send them a broadcast message, just trying to see if they need additional resources outside of food. So with the referral, we're going to initiate a new referral. We're going to initiate the food need referral. For this example, we're going to use a food pantry. That's what's on our platform. We're going to put, please call client to schedule food pantry pickup. We can do a couple of things. We can individually pick a provider that we're working with. We can pick the nearest provider from a selected list. The system can pick out the closest provider available based on where the client is located. So if we have your client zip code on the platform, we'll be able to send that referral out that way. So for this example, we'll do pick one provider. We'll do this one, and then we'll say that we have already collected consent. And then for the broadcast message, like Anita mentioned previously, for the SNAP workflow specifically, they were able to send messages to her team identifying people that needed additional services or needed maybe some more meals for that month. That's going to be our caregiver message. So that can be used to send directly to staff, directly to caregivers through phone, voice call, text message, or email. For this example, we're going to send a broadcast message back to the person that's being surveyed. So we're going to send this immediately. You can add a first name so it's more personal to them. So we'll do at first name, you identified as not needing food. If you would like more information about additional resources, please call 555-555. Awesome. And then we'll save that. We'll connect these to each other. And that's the workflow. That's how easy it takes to set up a workflow. You can make them as complex or as simple as you need to. Once the workflow is set up, all you would have to do is go and send that survey out to as many or as little people as you want to. So let's see. Here's the survey that we just did with the workflow attached. We can decide what channel that we want the messages or the surveys to go through. We can schedule those messages out if we don't want them to go right this second. And then we can decide what programs we want to send them to. We can get as specific or as broad as we want to or need to. We can add labels if we need more specificity in these programs. For example, let's say for some reason, weather is affecting one route on Anita's home delivered meals route, so we don't need to send this survey to the whole program. We just need to send it to one route. We can do that. We can go even more specific if we want to survey specific age, gender, language, disability status, and we can also add custom fields. For example, food preferences if we just wanted to survey specific individuals that require specific food preference. We can also send it individually. So if we just wanted to send it to all the Jennifers on the platform, we can do that. So you can be as specific or as broadly as you want to. I did create the same workflow just a little while ago and sent it to myself. And as you can see, it automatically sent it right back to the organization that we're referring out to. So it sent it to the food pantry. The food pantry on their end will receive an email. They will also have access to their own Blooming Health platform without your data on it. They'll just be able to add comments. They'll be able to close out the referrals. And then taking that a step further to go into closing the loop. Once a referral is resolved, or if it hasn't been resolved, canceled, or there was no updates on it, we can automatically send a survey out to the original receiving client. So we can ask them, did you receive the food? Did you like the food? How easy was it? So it really closes the loop and makes sure that the client is actually getting the resources that they needed. And then additionally, we also sent a broadcast to myself if I identified as not needing food. And you can see here, let me zoom in a little bit. It added my first name and then it said you identified as not being food insecure. If you are in need of additional resources, here's the number to call us. So all of this is automatic and all of this can be easily sent by utilizing the workflow and the survey functionality feature. And I know I talked a lot, but Anita, did you have anything to add as you have been one of our clients that have set this up on your own?
I think it's really important for people to know there is a step-by-step walkthrough when you're doing the workflows that says click here, click here. So I think that's really helpful.
Yes, and something that wasn't here when you set up the workflows is we also have this help bot feature, and it does connect to our customer success team if it gets a little bit too difficult to understand or if you need a little bit more guidance. So this is something that is also available to all of our Blooming Health platform organizations.
Awesome. And I did get a question in, and I'd love to hear Anita, Jen, your guys' answers. But this person asked, how long does it take to set up? And that demo was our setup.
Yeah,
Yeah.
I mean that's pretty much how long it takes to set up. I mean the first time I did a survey, I was, looking at all the different options and reading into it more. So definitely less than an hour.
Great. And then I
Yeah.
have one more from the audience here. Um, what size does your organization need to be to take advantage of this? That is an interesting one, Jen.
Yeah, you can have one person, you can have hundreds of thousands of people on the platform. It really does not matter as long as we're helping you. So if that's one person, if that's 10 people, if that's a million people, we can definitely help out.
All right, that is fantastic. Well, thank you so much, Jen and Anita, and everyone who joined our webinar today. This recording will be live on our website and our YouTube channel within the next day or two. And make sure you're following us on social media to keep up with all of our future webinar and events. Make sure you look out for Blooming Day coming to a city near you, hopefully, sometime this year. Thank you so much, everybody, and have a great day.